Welcome back, listeners. You're listening to EBC Radio. This is 1170 AM. It's time once again for our bi-weekly program called Heartbeat. Heartbeat is an educational program which airs on EBC Radio every couple of weeks, and we talk about your health, and hopefully we educate you and you enjoy the program and learn something from it. I'm Dr. Dinesh Singal. I'm an interventional cardiologist. I'm the director of the catheterization laboratory at St. Peter's University Hospital and an attending cardiologist at Robert Wood and Princeton, with offices in Somerset, Monroe, and East Brunswick. Again, we come to you and our intent is to educate you, so hopefully you encourage your friends and family to listen to the show. Today, we're going to talk about a topic, and when I look back the last 15 years of running this program, I don't think we've discussed this, and it's a very common problem which all of us face in a variety of ways. I, as a cardiologist, have a lot of patients who come to me, even though they're coming to me with a heart problem. Problem of anemia sometimes will aggravate the cardiac condition they're facing. And I'm joined in the studio today with Dr. Beiqing Pan. She is a hematologist oncologist with a group called RCCA in the Central Jersey area, and she's going to help us understand this problem of anemia, why it occurs, what are the various kinds of anemia, how we go about making a diagnosis as to why someone has anemia, and how to go about addressing it. So just to lay the stage, we have three kinds of cells in our body. There are these what we call red cells, white cells, and platelets. And anemia is related to a problem with the red cells in some shape or form. So as most of the listeners know, I usually start from very basic issues, help you understand the basic physiology of how the body works, and then we kind of build it up from there. So with that, let me welcome Dr. Pan. Thank you so much for joining us in the studio today.
Very nice to be here. Thank you.
So, these red cells are responsible for anemia. So before we get into the depth of what is anemia and how we define it, let's help our listeners understand a little bit about red cells and where they are made and what they do in the body and what their importance is.
So the red cells and the other cells, it's all produced in the bone marrow. So the red cells, they carry the oxygen to your body. So if you have anemia, that means the red cell production is less or destroyed, and then your body has less oxygen saturation, so you will feel very tired. You can be shortness of breath when you exercise, and also some people can have some very special, like if it's an iron deficiency anemia, they can have a pica, something like a craving for ice, or something very unusual stuff like a chalk. And I even have a patient have a craving for rubber band.
So as you pointed out, these red cells play a very important role. They carry oxygen to the rest of our body, and if there's not enough of these red cells, then we have a variety of symptoms, and we'll get to those in a little bit more detail in a second. But and these red cells are being manufactured in our body in the bone marrow. Now, bone marrow, are there certain bones in the body which produce more of these red cells than others?
Yeah, so the bone, essential bone, like a vertebrate in the pelvis, that's the most common place to have a production of the red cells and also the other cells too. So the iron, vitamin B12, and the folate, that's a major material to make the red cells. So if you have a nutrition deficiency, some people like anorexia, they don't eat well, have this, eating disorder, so they can also have anemia too.
So like any other, like any product, you need to have certain substances which are responsible, and then you wind up with an end product. So the ingredients, almost like making a dish, the ingredients which are needed, not directly but in some indirect fashion, are these vitamins and iron which you talked about. So vitamin B12, folic acid, and iron. These are kind of important components which play a role in the manufacture of these cells in the bone marrow.
That's right.
Now, so on the one side, if there could be a problem with somebody where not enough of this is being made, and on the other side, there could be a situation where it's being lost. Now, the term we typically use to define or quantify in some shape or form this amount of red cells, the word we use is hemoglobin.
Yes.
So when we use the word, because we measure the red cells also, so what does the word the term hemoglobin represent?
So hemoglobin is a protein in the red cells. It's a tetramer. They carry the oxygen. So usually if the color is red, that's why, the red cells is red color. So if the number less than 12 gram, and that's for women, it's anemia. For men, if less than 13 gram, it's anemia.
Okay, so and what's the typical normal range for someone, men and women, in terms of that hemoglobin number? Because occasionally people have a lot more of it, right?
That's right.
What's the normal general range?
For the men, usually 13 to 18.5 considered normal range. And for women, if it's 12, between 12 and 16.5, it's considered normal range.
So when we say someone has anemia, we are implying that it's lower than that certain number.
That's right.
And but are there degrees of that, in the sense that if I walked in and I should have, let's say, 13 and mine is, let's say, 12, technically that's anemia.
That's right.
So, but maybe it's not as serious, right? So,
That's right.
How do you quantify or define, the grades of anemia? Who do you think is sicker than the other?
So, of course, like if it's less than 10, you would think a kind of moderate, but if it's less than 8, and probably it's severe. So everyone probably has a little bit of classification. But usually if patient has a blood count less than 7, hemoglobin less than 7, if a patient has symptoms, they are indicated to get a blood transfusion.
So we defined you described what hemoglobin is. It's part of the red cell which is carrying oxygen, and we have a measure of it, and you gave us some numbers. We now know when we would call this anemia. So as you pointed out earlier, one of the consequences of this low hemoglobin is that our blood is not being able to carry the oxygen to the rest of the body. So I just want to go over the symptoms again. So if there's not enough oxygen being carried forward, there's a variety of symptoms. So some could be related to the heart, some could be related to the lungs, some could be just general. So let's just enumerate some of the common symptoms which a person who has a fair amount of anemia would show.
So most of common people report very tired. They can't do much job, like a normal job, cannot done, always feel very tired, want to have nap, more frequent napping time, or dizziness, lightheadedness. Also can have a palpitation because, the heart try to pump more blood out of the heart and then to reach the body to get more oxygenation. Right.
So because since the blood does not have enough hemoglobin to carry the oxygen, the rest of the tissues, and especially the heart, is trying to overwork in order to pump it more frequently so that somehow we can get some oxygen to the rest of the tissues.
Yeah.
And people also feel short of breath also.
They feel shortness of breath, yes.
Right. So in some ways these are very non-specific symptoms, because there are a lot of other conditions which could do that.
Yes.
And that makes our job a little harder, because we have to figure out what's wrong, but anemia is a problem which can sometimes occur.
Yeah, but I think because every doctor almost they check a blood count,
right.
So that's kind of screening test to see whether the number is okay.
So, folks, you're listening to Heartbeat. This is EBC Radio on 1170 AM. We're also live on the web, www.ebcmusic.com. I'm Dr. Dinesh Singal. I'm joined in the studio today by Dr. Beiqing Pan. She is a hematologist oncologist with RCCA, which is a large oncology group in the Central Jersey, and we're talking today about anemia. So, so that kind of brings us to the test you just mentioned. What is that test called, which is routinely done by physicians in the office?
So we call CBC. Basically, it's a blood count.
So CBC stands for complete blood count.
That's right.
So in that, amongst other things, it also measures the red cells as well as the hemoglobin.
Hemoglobin and the white cells and the platelet.
Right. So almost every time somebody goes to any doctor's office or a hospital,
yeah,
or whatever,
almost every doctor.
Almost every time,
yeah.
right? The CBC. So it's a very commonly done tool. It's very easy to do. Sometimes people will just do a hemoglobin, something called hematocrit, right? So HNH we call it in the hospital, but it's very commonly done. So let's say someone gets the blood test, and we find out that it is the person's anemic, means the count is low. Now, as you pointed out, it could be a variety of different reasons.
That's right.
So how do you go about trying to figure out what the underlying cause is? Why is this person anemic?
So usually we take a look at the blood count as a whole and see whether the white cells is also normal and the platelet also normal. Usually if 3 of them all not normal, and then most likely it could be bone marrow problem.
And the reason for that is because bone marrow not only produces red cells, but it's also producing the white cells and the platelets.
That's right.
So if all 3 are low, what you're saying is it could be a problem in manufacturing.
That's right.
And if let's say not all 3 are low, then?
So if just anemia, and usually we try to see the cell size, it's called an MCV. So
the red cells have a certain size which we can measure. So not only can we measure the number of red cells in the blood, but we can also measure the size of the cells. And so what drives the size of the cell? We know a certain normal range. So it could either be more or larger in size, or it could be smaller in size.
That's
help us understand what causes a smaller size and what's larger, and how do you use that information to decide the kind of anemia the person may have.
So the normal range is between 80 to 100. So if it's less than 80-100, we call microcytic. The cell is smaller.
So micro meaning small,
smaller.
So it's a smaller cell, right?
Yeah, so smaller cells, the most common is iron deficiency anemia, but also can be genetic. People have thalassemia. They can have a low, MCV. So that's the most common one.
Right. So just to recap, if the cell size is smaller than what it should be, we call it microcytic. And the 2 reasons you pointed out, the more common is iron deficiency.
That's right.
Or a condition called thalassemia.
Yeah, so thalassemia is genetic disease. So most of the people already know they have thalassemia or not. Sometimes if it's just a thalassemia trait, they carry the gene, not necessarily know they have they might don't have anemia, but the size of the red cells is smaller.
Got it. So on the one hand, it can be smaller, but it also can be bigger. Does that mean something?
Yeah, so when it's bigger, most common is vitamin B12 deficiency, and also can be folate deficiency. Sometimes people are alcoholic, and they can have a macrocytic. That's mean like the MCV is larger. So most common hematological disease is a myelodysplastic syndrome. The MCV, the cell size is bigger.
Okay, so let's just recap this because people may not get it. So if the cell is smaller, it's microcytic.
That's right.
And we talked about 2 things, iron and thalassemia, iron deficiency and thalassemia.
Oh, there's another condition called anemia of chronic disease.
We'll come to that in one second. That also, the cell size is smaller?
Yeah, it can be smaller, but not as severe as the iron deficiency anemia.
Okay. So if the cell size is smaller, it's microcytic. If the cell size is bigger, it's macrocytic.
That's right.
And in macrocytic, it could be vitamin B12 deficiency, folic acid deficiency, and
myelodysplastic syndrome.
So now that we're getting a little complicated. So myelodysplastic syndrome is a condition where the bone marrow is not functioning right.
That's right.
But in those instances, the platelets and the white cell will also be lower?
can be affected, but it can be just anemia.
So it can get complicated. So, but just to keep it simple, the cell size could be small, normal, or larger. If it's small, we talked about what the conditions are. If it's larger, then we start thinking about some vitamin deficiency and this myelodysplastic syndrome. Now, there could be anemia with a normal cell size also?
Yes.
Okay, so cell size doesn't have to necessarily change. You can just
That's
have
right.
a lower count with
so we call normocytic. So basically the cell size is normal.
Right.
People can have a aplastic anemia, can have a multiple myeloma, can have anemia, have a leukemia. So they all can associate with anemia.
Right. So we don't want to scare people, so we will tell them that leukemia is one cause, but it's a very uncommon cause, right?
That's right.
It's not
It's
that
very
common,
rare.
Right, very rare. So most causes of anemia are generally benign and not that serious. So now let's kind of get into so let's talk about the microcytic anemia. So thalassemia we'll put aside because it's genetic. There's not
That's
much
right.
you can do about it. Runs in
Yes.
families. So the other common one is iron deficiency, right? So
That's right.
So why would somebody be deficient in iron?
So iron deficiency anemia can be absorption problem. People have a celiac disease, so the villi of the intestine, they're not absorbing iron. Or some people that have gastric bypass, so they basically the stomach is a place to absorb the iron. So you have a gastric bypass, so you don't have enough surface to do absorption.
Right. So in other words, in order for our bone marrow to make these cells, it needs iron, and the source of iron has to be the nutrition we get.
That's right.
And that iron has to get absorbed from the intestine into the body. And what you're saying is that there are some people who do not absorb that iron well enough, and they get anemic. Or can they not eating enough iron? Does that happen too, or is it usually just an absorption issue?
Can be the demand is more than usual if you are pregnant, so you need a much more iron.
I see. So you're taking it, it's getting absorbed, but you're not taking enough of it.
That's
because
right.
your body needs more.
That's right.
So what are some of the common food items which have iron in it?
So we will recommend the patient to have animal product, heme iron. Heme iron is mainly beef, red meat, beef.
Okay, so now I just
pork.
So from as a cardiologist who's very passionate about preventing heart disease, I'm just going to throw a warning in there that I talk a lot about staying away from animal protein and largely red meat. But we're making a discussion on anemia, so that's one source if somebody is taking it.
Yeah.
Although
so
my position is don't eat any of that stuff. But
some people they also eat liver and blood, so that's also very good source for the iron. But of course, you can take lots of vegetables like spinach is mentioned.
So I would go with that. So
for Chinese, actually, we use dried dates. Some South American, they use beets. Those is not too much iron inside, about like a several milligram. If you have a cup or 100 gram of the product, and it's only has about like a 3-4, that's most milligram. So you have to eat a lot.
Right.
So the food, usually it's about a 10% absorption rate. So if you need, for the men, the regular, you need about 1 milligram a day. So you lost about 1 milligram a day from the GI tract. So you need a 1 milligram supplement. If the 10% absorption rate, so you need actually 10 milligram iron a day. The food you get from the regular diet, about like 18 for men. So you usually like a man does not have iron deficiency anemia. But definitely when they have iron deficiency anemia, it's always like a GI problem. You want to make sure there's no GI bleeding.
Got it. So when it comes to iron deficiency, which is very common, one issue we talked about is either lack of intake, total quantity, or increased demand, and so relative lack of intake and or poor absorption.
That's
so
right.
What's the other side of, we'll just present that the other side of the equation, which is the loss, and then we'll come back after the commercial break to discuss that. So what's the other side of the equation? What's happening with iron deficiency?
So people, for women, most common is menstruation too heavy, they might be not aware of that.
So which means we're losing blood.
That's right.
And therefore we're losing iron in that process.
Yeah. So for women, they lose about 1.5 milligram average every day. So you need a iron supplement about 15 milligram because about a 10% of absorption rate. But the women's diet usually only provide about 13 milligram. So most time, like if a little bit heavy menstruation, you will have iron deficiency.
So folks, we'll come back right after this commercial break and we'll continue this discussion with Dr. Beiqing Pan. She's a hematologist and our discussion today is about anemia. You're listening to Heartbeat. This is EBC Radio.
EBC Radio would like to thank St. Peter's Healthcare System, treating you better for life, for sponsoring the preceding program of Heartbeat Show.
An estimated 160 million Americans are either overweight or obese, which can lead to hypertension, heart disease, diabetes, cancer, and other health risks. The Bariatric Center at St. Peter's University Hospital helps adults identify and establish healthier lifestyle changes to lose weight. Treatment options include bariatric surgeries that are clinically proven to help adults lose weight successfully and transform their lives. The weight loss specialists at St. Peter's University Hospital, treating you better for life.
This part of the program is brought to you by St. Peter's Healthcare System, treating you better for life.
Folks, you're listening to EBC Radio. This is 1170 AM. We're also live on the web, www.ebcmusic.com. I'm Dr. Dinesh Singal. I'm an interventional cardiologist. The program is Heartbeat. We bring this show to you every second and fourth Saturday of the month. And I hope you enjoy the program. Today our topic is anemia, and we're joined in the studio by Dr. Beiqing Pan. She is a hematologist-oncologist with RCCA, which is a large hematology-oncology group in central New Jersey. For those who are just tuning in the first half we kind of defined what anemia is and kind of try to separate the various kinds of anemia. And we were talking about iron deficiency anemia, which is one of the more common forms of anemia. And so one reason people get iron deficiency, Dr. Pan was telling us, is if they're either not taking enough iron or it's not getting absorbed. And on the second side, it could be that one is losing iron, and the way you lose iron is if you're losing blood. And there's a whole host of reasons why that could be occurring. And so, Dr. Pan, the one common reason you said in women could be heavy menstrual periods. We see this all the time, right? So young women, menstrual periods, they lose a lot of blood. And if, let's say, it's if either the periods are not heavy or it's a female who is older or a male, what would you worry about if it's iron deficiency and you want to rule out the possibility that they're losing? So what would be the common things where they would lose?
So common side is GI tract. You can have a bleeding, gastritis, ulcers, and you also can have a colon cancer, hemorrhoid, also vessel malformation, all can bleeding. So you kind of have to refer patient to gastroenterologist. Most time they do endoscope first, upper endoscope, and also needed to do colonoscopy. If you do both of tests and not able to find out where is bleeding, the gastroenterologist also offer video capsule endoscope. So that's a scope, basically a capsule. You swallow it. They take the picture of the small bowel. Small bowel, there's several feeders, feet, and cannot be reached by endoscope.
Right. So basically, what you're trying to do is you're trying to look for a cause, and it could be, in most cases, a very benign cause, but it could be as bad as cancer. So
that's right.
The upper endoscopy kind of reaches the stomach and the beginning of the duodenum, so you can look at that.
and also esophagus.
Right. From the mouth down almost a little past the stomach they can see, and if they don't see anything there, they would do a colonoscopy.
Yes.
But that also can't get through, the small intestine is very big, so they can't find a cause there. then they use this so-called capsule endoscopy, which is like a little camera, which is a pill you swallow, and that little camera kind of makes its way down the whole intestine, and you can get a picture from inside to see if there's a cause.
Yes.
Right. So the that kind of workup is done by a gastroenterologist. So
Yes.
right. So now. So obviously, if the gastroenterologist finds something not right, then you have to address that, right? So,
Yes.
as a treatment for that.
Yeah, if it's gastritis, ulcer, it's easy.
Right.
Yeah, so they use a proton pump inhibitor.
Yes, so the
That's the most
medicines like
common.
Prilosec or Nexium or
Yes.
some medicine to help relieve the acid, right?
Yes.
And, if it's like hemorrhoids, you take care of the hemorrhoids.
If it's a vessel malformation, and they can do a cauterization just to stop the bleeding when they do the scope.
Right. So in the lining of the wall of the intestine, blood vessels form in a certain way that they're not behaving right and
Yeah,
bleeding, right?
very
So that's
easy
called
to
a vessel
bleed.
malformation. So they can cauterize it so that the bleeding can stop, right?
Yes.
Okay. And obviously, if it's unfortunately some polyp or cancer or something, they have to take care of that.
Yes.
So that in some ways the anemia can be a symbol or a sign that something else is wrong, and can actually help us diagnose another major issue in time.
Yes.
Hopefully that it can be helpful.
Yeah, for women, other thing to mention is if they're postmenopausal, if they have vaginal bleeding, it's always not normal. So they have to see gynecologist. They have to do endometrial biopsy to make sure there is no endometrial cancer.
Right. So clearly, if someone is losing blood, then we have to find out where they're losing it from, and we have to address the underlying cause.
That's the most important part.
Right. But on the other side of the spectrum, which we talked about earlier, let's say they're not losing anywhere, but they're not being able to absorb. So there are two things we talked about, right? So if they're not taking enough, but their absorption is good, then you can give them just orally. You can give them more iron.
Oral iron supplement.
Right. And so let's talk a little bit about that. I know you started mentioning it. What's the appropriate dose to generally for most people to take if they had to take oral supplement of iron?
So oral supplement, most common one we use is a ferrous sulfate. They come with 325. There's an elementary iron about 65 milligram. So if you don't have iron deficiency anemia, if you take one pill, that's more than enough. As I said before, for men, they only need 1 milligram a day. So if it's 10% rate of absorption, so they only need 18 milligram. For women, it's 1.5 milligram if you're menstruating. So you need 15 milligram of diet iron. So 10% absorption rate. So if you have 365 with the element iron 65 milligram, so one pill you have more than enough for a day's supply.
So let's talk a little bit about that. If somebody is not iron deficient, or they're only mildly deficient, and they think, okay, you know what, I should take iron, and they take more than that, can extra iron hurt the body more than what is needed?
Unless patients have hemochromatosis, so they have a certain gene mutation problem, they have absorption, they absorb any iron, you digest it. Otherwise, the body has a protein called hepcidin, and they actually able to adjust the absorption. If you lack of iron, they absorb more. If you don't have deficiency, they actually goes to toilet.
But my question is, can someone take too much iron?
With one pill a day?
No, but let's say somebody decides, I'm going to take 3 pills a day. Can we take too much? If you I guess if you take too much vitamin C or vitamin B12, it's not a big deal because it's water soluble. The body just excretes it. But if we take too much iron in, can it harm us?
For adult, I don't think so.
Okay.
Yeah, because the body able to adjust. If you don't have iron deficiency, basically it goes to the toilet. It's not absorbed.
I see. It won't absorb. Okay. So, but in general, most people don't need to take too much.
That's
they need
right.
to take what is recommended to them. And as you pointed out, there are certain ratios and certain quantities. Now, one of the problems with iron that it can cause some GI issues. So,
Constipation, yes.
so constipation is
Yeah.
one problem.
Constipation is the most common. Some patients actually they can cause diarrhea, but that's very rare. Most common one is constipation, and also can have a stomach discomfort. So we ask the patient to take with food, and also take vitamin C. So vitamin C is acid. Acid help the absorption of iron.
Got it. And isn't there a little change in the color of the stools also when someone's taking iron?
Yes, it can be like a little bit dark or greenish.
And so the challenge becomes sometimes you don't know if it's actually bleeding or is it because of the iron the color is
Yes.
changing, right?
That's right.
Yeah. Actually, that brings me to a question which I should have asked earlier, is that one very simple test which even a regular doctor can do in the office, even before all the colonoscopy, is there is a stool test we can do, right?
Yeah,
to check
it's
for
called
bleeding?
fecal alcohol blood.
Right.
So you just have 3 separate samples, and you put it on a card, and then they they put a solution on. You see the color change, so it shows you whether you have a bleeding or not. But the sensitivity is not very high. If you do 3 separate tests together, the sensitivity about 60%. So that means like even it's negative, it could still missing your bleeding.
Got it. So yeah, just because it's negative, you shouldn't assume that everything is fine. You still need to, if you're deficient, you need to look for it.
That's right.
So the ferrous sulfate is an over-the-counter medicine, or is it a prescription?
It's an over-the-counter.
It's over-the-counter. And are there is the generic form in ferrous sulfate as good, or sometimes I hear there are certain brand names? Are they any better, or it's all the same?
I think it's all the same.
All the same. Okay.
Yeah.
And do you also, when you find somebody who is deficient like this and you're advocating oral intake, you just focus on a pill, or you in addition tell them certain food items they should be taking?
Yeah, the food we discussed is
okay,
like,
right. We're
you know.
not going to go there
yeah.
because I'm not advocating animal protein on the show. Okay. Okay. So, so now we have extra iron being taken for those people who are deficient. Now, I encounter this in people who've had open heart surgery and all. They typically come to us. They're anemic because they've lost blood during the surgery, and they're taking iron supplements. They're not going to need that forever, right? If they were deficient, if they lost, like let's say if somebody temporarily lost blood and they were anemic, you supplement it. Unless they're continuing to bleed, they will reach a point where they will not need any more. I mean, you've kind of replenished it.
Yes.
Usually how do you know when to stop?
Yeah, usually we recommend about 3 to 6 months.
Right.
But I mean, you're checking the blood count. If it's all back to normal.
So you're checking the blood count regularly, and that tells you that.
If it's back to normal, then you can go back to your diet and with a little bit more iron.
Okay. So a person who's not actively going on, actively has ongoing bleeding, doesn't need to take that iron forever. They just stop when your blood count comes back to normal. Okay. Folks, you're listening to Heartbeat. This is EBC Radio. I'm Dr. Dinesh Singal. I'm talking to Dr. Beiqing Pan. She's a hematologist, and our discussion today is about anemia. So now let's take the situation of someone who is not absorbing. So you're giving them iron, but it's doing no good because it's not getting absorbed. What are the solutions for that kind of person?
So we have an IV iron. Okay. So for the people who have a gastric bypass, so they have absorption problem, and we give IV iron. Some people they have lots of side effects. Actually, like an oral iron, you can have a nausea, vomiting too. Okay. So lots of constipation, and then we give IV iron.
So how is that given? Is it given at home, in the office, in a hospital? How is it given?
It's given in the office.
Okay. And how long does that infusion take place?
Yeah, usually take about a half hour to 1 hour. Depends what kind of iron form you give.
So there's different kinds of iron?
Yeah, there's several, at least 4 or 5. So most common one we do is injectable. So they come with 750 milligram. So that's a high dose. So if you need like 1,500, so you only need an IV for 2 times. So, but there is also small dose one, like a Venifer. They come with 200. So if you need 1,600, you need like an 8 injection, right? So for convenience, I think the injectable probably I will choose. And also this is a relatively new, and compared to the others, less side effect from IV, for the IV form of iron.
So you give 2 infusions. They take about a half hour to an hour each time. What's the interval between the infusions?
Usually once a week.
So they come once, get it done another week. Now,
that's right.
Is that usually enough, or do they need repeat infusions down the road?
So we kind of calculate how much you need. So if you have a hemoglobin 8, and if a woman, the goal is 12, so you lack of 4 gram of blood. So 1 gram actually they need about 250 milligram of iron. So 4 gram is about 1,000. So then you calculate how much storage iron you need. For women, they're about like 500. Some people say 300. So you calculate it together, it's 1,500. So for the man, actually storage is 1,000 milligram. So you add 1,000 milligram. So if it's 8 and then actually it's 13 is normal, so you need 5 gram. So it's basically 1,250 milligram and plus 1,000. So it's 2,250 milligrams.
So you're not only replenishing what's obviously missing to get the hemoglobin up to a normal level, but the body has the capacity to have a storage to store iron. So you're giving them extra on top of that, so you have some reserves built up.
Yes.
Now, so let's say someone has a problem with absorption, and you calculate and do your math and you give it to them as a one-time deal, or these people might need it again?
So it depends whether you have more bleeding or not. So it's kind of like a tank of water. If you're losing blood, I give you refill and always not be able to feel reach the normal range, right? But you have to kind of like stop the bleeding first. That's the most important thing.
So the bleeding end is one issue, and then if it's an absorption issue, then obviously that absorption issue is going to persist. So they may need some frequency.
Yeah, for those patients like a gastric bypass patient, and probably they need an annual infusion. So every year come once, and as we calculate it, if it's a woman, it's 1.5 milligram a day. So you're kind of like about 500 a year. Probably it's enough. And for men, it's 1 milligram a day. So you see like how much physically, how much you lose, and then you see how much replenishment you need.
And if somebody was anemic and they were symptomatic, more often than not, when you give them iron, do they start improving, and how long does it take for them to improve?
Most of the people, they feel better right away. It's just because lots of enzyme in your body. They also need iron to function well, so they kind of feel well right away. But for the hemoglobin to increase, it takes about 2 weeks to increase start to increase. So most time probably by a month or 2, and you should have normal hemoglobin if you don't have additional blood loss.
Got it. So we kind of talked about the so-called anemia can be microcytic, in which case very often it's iron deficiency, and we addressed that. We also earlier talked about when it's macrocytic, and we talked about vitamin B12 and folic acid deficiency, which causes this macrocytic anemia. So let's talk a little bit about that. You now see somebody's cells are big. How do you know somebody has B12 or folic acid deficiency?
So B12 deficiency have very specific presentation. They can have a peripheral neuropathy. They can have numbness, tingling sensation. But of course, we can just check vitamin B12 level and
so
also
folate
level.
Yes. So you do it's a simple blood test which will give you levels, and with that you know that they are the deficiencies. Of the two, which one is more common? B12 or folic acid?
I mean, usually B12 is more common because folate in United States, all the flowers is fortified with folate. So usually you don't have a deficiency. If deficient, most people, they might drink too much alcohol. So there's an absorption problem.
Got it. So the more common is vitamin B12. Folic acid can occur in alcoholics, but in general, our food has so much folic acid that we generally not deficient. And so, what are some of the common causes of vitamin B12 deficiency?
So there is a disease called pernicious anemia. Pernicious anemia. Right. So because on the stomach there's intrinsic factor, they have antibody, so they're not able. They're supposed to carry the vitamin B12 for absorption. So if they have antibody, not able to carry the vitamin B12.
So when we take food or any product which has vitamin B12, when it gets into the intestine, in order for it to get absorbed, it needs some help. And it needs help from this other factor, we call it the intrinsic factor. And if there was a problem with that, the B12 will not come in. It kind of needs almost like a ticket to get into the intestine, and if that ticket is missing, it won't get in. And how do you see that often, this deficiency of this intrinsic factor, or pernicious anemia is what we call it?
Yeah, not common.
Not common.
Yeah, usually we refer to gastroenterologists, so they do an endoscope and see whether they have any gastritis. Can be associated with gastritis.
Got it. So the gastroenterologist will work up somebody with pernicious anemia, which means that they have that missing intrinsic factor. So it's not a problem of not taking enough vitamin B12, it's just not getting into the intestine, almost like the iron not getting absorbed. So how do you circumvent that issue if somebody has pernicious anemia and the B12 is not getting absorbed?
Patient get an intramuscular injection of vitamin B12. So at the beginning, they can get it every day, and for a week afterwards, you change to every month.
Every month. So once a month, they get an intramuscular injection, right?
Yes.
So that helps. And if, let's say, it is an alcoholic with folic acid deficiency, how do we replenish that?
You can give folic acid. There is a folate
And ask
pills.
them to stop drinking alcohol.
Yes, that's the most important one.
Yeah, that will help. Okay, so those are some of the common causes of anemia: either deficiency of iron, not absorption, B12, folic acid. You talked a little bit about, or you mentioned something called anemia of chronic disease. So what does that mean? So there are people who are anemic, but they're not deficient in iron or B12 or folic acid, but they're still anemic. And so what's anemia of chronic disease? We see this very often in the hospital.
Yeah, so people, they have a chronic inflammation, something like a rheumatoid arthritis or chronic kidney disease. So kidney is the place they produce erythropoietin. This is the hormone to tell the bone marrow to produce blood. So if they have renal insufficiency, the kidney failure, and they're not producing erythropoietin, that can cause anemia of chronic disease.
Okay, so I'm just going to expand on that a little bit. So our kidneys produce a substance, it's called erythropoietin.
Yes.
And this kind of is a messenger or a stimulant, so it goes to the bone marrow and tells the bone marrow to produce more iron, or so more red cells. And if there's underlying kidney disease, so people can get anemic. And so a lot of people, as we get older, have kidney disease. That's very prevalent, right? So
have to reach a certain time, like a certain stage.
Right.
So if it's severe,
right.
It's a kind of early stage, probably not affecting the red cells.
Got it. So how do you treat somebody who has anemia of chronic disease, which where maybe there's a problem with erythropoietin?
For anemia of chronic disease due to kidney problem, we give this man-made erythropoietin called a Procret injection.
So we can give that, and that can go and stimulate the bone marrow to produce more of these red cells.
Yes.
How is that given? Is it an IV or an intramuscular?
It's a subcutaneous injection, but if a patient, they are hemodialysis, they can do IV with hemodialysis.
And how often does that need to be given?
For the not a hemodialysis patient, we probably do like once a week, and to see how patient responds to the treatment. If it's doing well, you can change the interval to every 2 weeks or 3 weeks or 4 weeks, or it all depends on how patient responds to the treatment.
Sure. We only have like a couple of minutes left, and I know we just only scratched the surface. There are so many other causes of anemia, but I think we touched on the bigger causes. In general, do you find men have more anemia than women, or the other way around?
I think women has more iron deficiency anemia because of menstruation and pregnancy.
And do you ever see it in children?
We are not like a pediatric hematologist, so we don't see children.
So you don't see children.
Yeah.
So, yeah. And so is there certain general advice for listeners in general? Because it's such a common problem. What should they be doing, either in terms of seeing a physician or just in terms of nutrition? What's just general advice to avoid anemia?
Yeah, so I think balanced diet should be fine. What we are recommending for patient, the more like Mediterranean diet. They're considered as the most healthy diet now. So lots of fish and vegetables, that's considered healthy, and the nuts. But I think in general, if you don't have a deficiency or like losing blood, and a regular diet should be enough. But if you're pregnant or your menstruation is very heavy, definitely have some iron supplement. And I think the one pill a day or even other day, some studies suggest if you do every other day, actually the absorption is better than once a day. So you can do every other day, so not too much constipation or stomach discomfort.
Right. And the other thing is that people should they get a regular blood test when they go for a physical exam, at the frequency the doctor recommends, and also to keep a lookout and change in stool color, and get a regular screening colonoscopy and things like that.
Yes.
Right.
Yeah.
So with that, we're coming to the end of our program. I really appreciate. We were talking to Dr. Beiqing Pan. Thank you, Dr. Pan, for coming.
Thank you for having me.
And our discussion today was about anemia. I'm Dr. Dinesh Singal signing off. And we appreciate St. Peter's University Hospital for sponsoring this program. Program was Heartbeat. And I hope you come back for another edition of Heartbeat in a couple of weeks.